What's going on, guys? Welcome back to W.D.Y.D CSP. What do you do as a central stove processor? Guys, this is part 5 of inspecting basic instruments. Stay tuned. Alright guys, today we are inspecting and testing suctions. Not much of a testing here, more of an inspection, but there are so many different types of suction, guys. Here I have some Fraser suctions. You have Barron suctions, you have Pool suction, you have Yankars, you have Andrew suctions. So many to name, guys, but this is a general video on the inspection of suctions. Now, on the suctions that you have larger openings and larger cannulas, if you have a borescope of the correct diameter and size to utilize, that is best practice, guys, to use a borescope to look down your cannulated items for cleanliness. All right, there are other methods. If you do not have a borescope, guys, then you can do what's called soil testing. So with soil testing, guys, whether it's ATP or not, you would grab a little brush that's available with the unit, go down the cannula, collect the sample, put it into a tube. If it's a protein swab or ATP, it gives you a result in 5 to 15 seconds, some of them up to 5 minutes. If you don't have that, then we have to go old school. And old school is probably the method that I'm probably more leaning towards with this video. Simply because this one's the most debated, guys. Should you have brushes on the clean side? In my opinion, yes. They are a crucial tool for inspecting cannulated items on the clean side. So first, let's talk about what we're looking at with a suction and what you should be inspecting. So guys, a suction's usually, there's some that have removable tips, but we're going to talk about the Fraser suction alone. So you have the actual vent port here. So this port here is held down for continuous suction and released to release any fluids or to have like an intermittent and a slower suction. One of the things that you want to inspect is a trick in the OR, or I'm not even gonna say it, but what we do in the OR is we place a piece of adhesive over the little vent port so it has consistent and constant suction. You release that suction, that little valve, so it can stop suctioning just in case it gets caught up on tissue of some sort. But anyway, you want to inspect for any adhesive. Where the tube enters the base of the thumb operating part of the suction is, you want to make sure that there's no cracks, no bioburden in the welded part of the instrument. Okay, so you want to inspect that. You want to inspect for any bends and kinks that will hinder the suctioning or restrict the flow of suctioning in the actual tube. And then for certain specialties, you want to inspect that tip. A lot of times those tips will be sharp. You want to look for sharp edges or any cutting away at, any wear and tear on the distal tip of the actual suction. You want to look at the actual connection port to make sure that there's no bioburden or any soil. And as far as you can see in there, is you want to look for visible soil or anything caught up in there. So again, borescope is your best bet. If you don't have a borescope or the wrong diameter borescope, then you have to resort to soil testing. You should be doing some kind of soil testing. If you're not doing anything like that, there are different ways to collect different methods of soil testing. You have protein, you have specific soils that you can test for, like hemoglobin, lipids, sugars, things of that nature, or just general protein. Or you can do an all-around ATP test. Those are available by several manufacturers, very easy to use, give you fast results. So in this video, I don't have none of that. Okay, I have none of that. I don't even have a syringe, so I can't even show you the syringe method. So the syringe method would be, you have some sterile water in a little basin. You draw up a little bit of sterile water, thumb off the port, connect the syringe and squeeze a little bit of water into that cannula so that it can drip onto a white surface to see if anything comes out. Then you have places that use instrument air to blow out their cannulas. I'm cool with instrument air, but in my opinion, I believe instrument air should be restricted to use in the decontamination side. The use of instrument air over in the clean side poses too many risks that I will be gladly to discuss with anyone who wants to chat about it. But instrument air on the clean side, to me, is very risky. Shouldn't be on the clean side. It should be in decontamination only. So what are you doing in the actual station with these brushes? Well, first, I want to say that you should have a very well-defined brush policy if you're using brushes on the clean side, okay? Brushes on the clean side are for inspection purposes only. They are not for cleaning. I will repeat that again. Brushes on the prep and pack side or assembly side are for inspection purposes only, and your policy must be very definitive of that. You also need to define how often are your brushes being cleaned. If they're reusable, are they a one-time use? Do you throw them out at the end of the shift, the end of the day? Your policy should be very defined as to stating what that is. I also recommend that brushes be distinguishable between the ones in prep and pack side and the ones used in decon. You shouldn't be using the same brushes, so there's no confusion as which ones are used for cleaning, which ones are used for inspection. These are pretty cool ones that I like over in the prep and pack side because they're different from the wire ones that we usually see over in decon. There is no confusing as to which is done, which is which, and this one would be for inspection, the other one's for cleaning. You also have these little pipette cleaners, these little pipe cleaners. Cool concept. I just don't like the fact that these little things will lint on you. Okay, they will shed on you, and if you throw this down a cannula and there's some little rough edges in there, you might leave some lint behind there, and if you don't have anything to visually look down there, then you potentially left some lint in there. I talked about the actual syringe method, which I don't have a syringe, so I'll talk about my brush method. Okay, the way you should be use a brush if you don't have any cannula, if you don't have any syringes to flush any stored water, is take the end of your brush and dip it in some stored water. Okay, that gives it a little bit of lubrication, that if any soil is actually dry inside the cannula, you can actually moisten it and loosen it up, and it'll get caught on the actual brush. Of course, you want to use the correct diameter brush. So go down your cannula and come all the way down until it comes out the other side. Once it comes out the other side, guys, here's where many people, I tell a lot of people, if there is soil discovered on the end of that brush, do not pull your brush out. Okay, take this cannula, the set that it came with, send it back to decon with the brush still in the cannula. That way people in decon can identify that this was a soiled instrument. That brush should be removed in decon to remove any splashing or aerosolization over in the clean side. This brush should not be used to clean the actual cannula. This brush should be discarded. The cleaning brush that's used in decon will be used to clean the actual suction. So the suction should be rinsed, it should be soaked, it should be brushed, it should be flushed, it should be rinsed and sent back along with the rest of the set that needs to be re-cleaned because it was contaminated. Once it comes over to the prep and pack side again, you should have a brand new brush, guys. Again, do the dip method in some sterile water and send it down the cannula and check for cleanliness yet again. All right, the last thing I will leave you on, guys, is the reason I brought out these two suctions is on a note. These are the exact same suctions. Same size, 9 French, same manufacturer, same part number, but you see the difference? Either this one was repaired so many times or it was modified. That is a no-no, guys, all right? But anyway, guys, I hope you found this video helpful, informative. If you have any questions, please hit me up. Guys, I'm willing to discuss any method of inspecting suctions. As always, guys, stay true to yourselves. Keep it 100. Peace. See you on the next one.